Hi, I'm Dr. Clifford Porter, Texas Direct Medical Care. Brief explanation of what we do in a direct primary care clinic. Many of you have, with Texas Disposal Services, have come to our clinic for testing and COVID testing and COVID treatment. I'm going to spend a little more time explaining a little more about what we do. So it's only 14 slides. It's a very short slideshow. So Texas Direct Medical Care is actually a membership-based clinic for the most part. We did a lot of COVID testing, of course, over the last 2 years. But being membership-based actually allows us to do a great deal different than what you think of traditional clinics. And so we do both primary and urgent care. Anything you think that regular doctors and an urgent care clinic do, we do that. This model is known as direct primary care, and there's about 2,000 clinics like this actually throughout the country right now. And this is just, we're one of the newer ones. The way we do this medicine really is actually makes things far better and actually far less costly. And in many ways, it's actually old school medicine, the way it was, the way it should be again. Now, combined with what we do with major medical programs, insurance, health share, other things like that, for specialty hospitalizations, you can actually very good, complete care at actually a quite reasonable cost. Now, quickly about overall what we do. Anything you think primary care clinic does, we do as well. But there's no co-pays or deductibles for visits. Because we're membership based, we don't actually have to go through all that system that other larger clinics have to go through. And in many ways, it's just simple, open, direct access. That's why we call it direct primary care with physician or physician assistant, as the case may be. And it's unlimited visits and telemed. And that telemed isn't necessarily video, it can be just a phone call or a text or an email and so forth. So in medicine, primary and urgent care, that's 80 to 90% of medicine. And so we can cover most things and all ages. We like the new babies as well as those who are slightly over the age of 21. And as I said before, you know that we do a lot of active early and COVID treatment. The in many ways, our telemed is significantly different because it's not a structured system. For those who've done a virtual visit, they can be very structured, just like going to a doctor's office, except you're doing more online texting, more paperwork. Ours is if it's a text, if it's simple, we can combine it with a visit, an in-person visit if we need to. Now, our appointments, we're not fast. We can spend time. We can do 30 to 60-minute appointments if it's actually important. And even after hour and weekends available, 2 in the morning, leave a message, we'll get back to you right away. But we set up our schedule on purpose so that people can actually get in and seen if it's urgent that day, and usually same day appointments. And as I put on here, it's okay to call or email for refills or simple advice. We don't necessarily have to do a structured appointment. I, in fact, once refilled a gentleman's high blood pressure medicine. He ran out on a weekend when I was actually on a canoe on the Guadalupe. So we have simple things we can do for you. Now, specialist referrals, we do a lot of things, but we can't do everything, cardiology or rheumatology, things like that, obstetrics. So we refer as we need to, just like any other medical clinic would when a specialist is needed. We also do women's health, except we don't do labor and delivery. We love babies, but we don't deliver babies anymore. And then also put on there, telemed when traveling. I can actually prescribe most medications across the country. So if someone's on a vacation and something comes up, let me know. I can actually sometimes send prescriptions in for simple things like UTIs and other things like that. Now, we have 2 locations now. Many have come up to our Jester Clinic up on just north of Pennybacker Bridge off FM 2220. But we now have our new clinic on 1626 Northwest Buda, not too far south from the Starbucks there, 976 and 1626. And then we've grown in size. So it used to be just me 2 years ago. Now, Suzanne Self is a PA with many years experience who's joining us, and we'll be working primarily out of the Buda Clinic, and sometimes in Jester, and we'll sometimes switch, but mostly she'll be there as well. Now, real briefly about why we're different. Medicine's become extremely expensive, and here's a chart from the Kaiser Foundation showing how the rise of deductibles and co-pays and has been more expensive for businesses, for individuals, actually with worse care and access to care. Real briefly, the reason is for that, and you guys have seen this, where you go in to see the physician, PA, NP, as the case may be, and they're spending more time banging on the computer than they are actually listening to you in those 5-minute appointments. And the reason is what's called capitated reimbursement, literally getting paid by the head. And so they have to see so many people so fast, come in, make a decision, give a drug, send a referral, move on. Even when that's not necessarily needed, a little time could have actually done things better. Actually, isn't even a medicine or referral even needed. And then, of course, the doctor's spending all the time documenting. So worse primary care, worse urgent care, people going to ERs when they don't need to, delaying care, hospital, hypertension, diabetes, and then they end up in the emergency room when they simply didn't need to. So it's bad medicine for all of us, physicians and patients alike. Real briefly, if you really want to nerd out on all this stuff, I'm happy to send you stuff talking about healthcare reform and the problems, but you see enormous administrative burden that's developed. And that's why a lot of doctors' offices are so cumbersome, is there's just so much paperwork they have to do, all the various gatekeepers, middlemen, as we call it. And who's at fault? We don't care. We're just fixing it. Now, so by doing a membership based, that's how, we basically get reimbursed. We don't have to do it by number of people. So we just set up a good system. The administrative burden is gone, so it's not billing all the time. And then we actually have time to practice medicine correctly. And when you hear about physician burnout, some people will hear about that. That's because they have to go so fast and do bad care. We can actually do it right. So we really enjoy what we're doing. Now, as I said, travel medicine, virtual visits, that's part of it. And so we set up how many people are seen per provider so we can actually have access when you need it. And if you want to just call and chat about a medical issue, talked a lot of COVID the last 2 years, give us a call. We'd like to chat. And the other thing is we have time to do research, not just talk, but actually do research. More complex, difficult cases, as they come up, we can actually look into things and come up with new innovative ways, and talking with specialists, what's the best way for more difficult cases, or sometimes just not difficult, just odd and unique. Now, another thing we do is we do a lot of our own labs, and we do EKGs in our clinic. And we work with LabCorp actually, and a couple other labs. Because we avoid all that administrative burden, our costs are actually cheap. And this is actually a sample for me for a little cardiac screening. Humana TRICARE is what I had, and they billed $200 to Humana, LabCorp did, because they have to cover all their costs for administrative purposes. I got billed $11.50. The actual wholesale cost is $10 through our clinic, and we do that in our own clinic, so it saves everyone time and money. And depending on what plans people choose, we can actually get extremely cheap prices for various x-rays, MRIs, CAT scans, and things like that. And then most other things we get in the clinic, we get wholesale cost. We just pass that cost along. We're not making money that way. It's just on the membership. So bypassing the barriers and the gatekeepers. You don't have to call in to try and get an appointment 2 weeks out. We'll get you in. And if we're on vacation, we cover for each other, and other clinics like ours cover for each other. So we'll be able to take care of people. So less referrals, spend more time with us, less ER visits, hospitalizations. And, if you give us a call, there's no financial penalty. There's no fear, like we're going to it cost me more money. Give us a call. We'll figure out what's the right thing to do for you. Ultimately, bottom line there, better health, more time, less time at the clinic, although we like nice visitors. No one necessarily likes to visit us because we're usually sick, but more time with your family. Now, so direct primary care, just to summarize here, it's a foundation for better care. And so combining it with, depending which plans are, there's health share plans, so they're Christian health share ministries. Off the shelf, there's the traditional insurance plans, and then of course what the company's offering in terms of insurance plans. There's a variety of different ways. We are the foundation for it, working with others, complete, better, and happier medical care. So if you have any questions, please give us a call. There's both of our numbers, the Austin number, traditional, and then the new Buda number. And you can send me an email, and it's on the Dr. Porter at txmedicalcare.com. And if you have any questions, please give us a call. Thanks.